Hello, everyone. Welcome to Real Talk. I am Dr. Reshma, your host. Like always, I bring to you a topic that is important to me and you: dental health. The topic today is Happy Dent, Happy Health. More than 50% of the population has some kind of dental problems. However, only a few of them realize that and go to a dental clinic. Only a small percentage get their annual dental checkups. Now one can understand how it is in the rural areas when the situation is such in the urban areas. Today's world, we all suffer some or the other problem related to teeth, gums, lifestyle today, poor diet, fast food, cold drinks, lack of oral hygiene. These all things contribute to occurrence of dental problem in most of the cases. Almost 99% people suffer from dental issues before they reach the age of 60. So let's understand all about the dental problems and how we can take good care of our teeth by a regular visit to our dentist. So today with us, we have a special guest, Dr. Saba. She is a dental surgeon and a founder of Dr. Saba Dental Clinic. She is known for aesthetic dentistry, conservative dentistry. She is known for fixing RCT in one sitting and painless extraction. She has successfully treated many and is a strong believer and advocate of conservational treatment approach. Welcome, Dr. Sabah, to the show.
Thank you, Dr. Reshma. Thank you for such a lovely introduction.
Welcome, welcome. So today, Dr. Sabha, we are going to have pour you with a lot of questions because dental health is something that you will agree that we've really ignored a lot, and I don't know what the situation is going to be in the near future. So let's talk about it and also try to create this awareness among people who are our viewers today. So, Dr. Sabha, tell me your journey into this whole world of dental health.
Well, my journey to dentistry was like other dentists. It was following the procedures as being taught. But later on, in my experience, I realized that the number amount of dental diseases are increasing and the negligence is also increasing. So that is was the point where I realized now I have to somehow even do the treatment, and the patient who has come to me, I have to encourage to stop doing certain habits and to take care, so that whatever is causing the problem will just stop, and the amount of dental diseases that person has will decrease. So I target ki I solve the problem of the patient. Other than that, whatever the conditions of the teeth he has or she has, I try that nothing more happens. That is what I attempt to now, so that the dental health is better.
Mhm. Right. So, Dr. Sabha, there are a lot of myths surrounding, dental care, and ignoring dental care, I might say, there are so many myths that, dental health to theek hai if you take care of your overall health. So, what do you think about these kind of myths? How do we break these myths?
First of all, whenever a person has a myth, they shouldn't ask the colleague because they also carry the same myth. They should always go and ask the dentist. It doesn't take much. There are dentists available so easily, and it's very feasible now to get a dentist. So first of all, one should ask and correct the myth by asking it to the dentist, to the right person, and getting the right solution. There are many myths that people has that the teeth should be white. The teeth is never white in color. It is yellowish, And as per the color of the person, the color white might appear different. A person who is darker, it will appear whiter. A person who is white, the teeth will appear yellowish. So there is always a range, of the color, and it is not because of the color of the teeth. The color of the teeth is never white. So this is the biggest myth. I want to get a teeth whitening done and all. I don't believe that one should get a tooth whitening done until there is a requirement. There are a good amount of patients who require and their kind of work. And there are so many other myths. Eventually, if you go old, you will have wear a denture. You know, denture or over denture. I think if one takes care of their good health from the early on stage of life, they will have a teeth. little amount of bone loss will be there, but they will have a teeth and they won't require a denture. So it is not that eventually as you grow old you will end up wearing a denture. This is the biggest myth, I think, which have people have, and I don't believe in it. I think we can have over all the teeth if we want, if we just take care. And there are so many myths even about the extraction done. We remove the tooth and they will say ki hear loss, I couldn't see with the eyes, this
Hmm.
problem is there. It's nothing like that. The belief they carry in their mind because of the other person who has influenced their mind, actually that creates that kind of thing in their mind. Because the nerves are totally in different side, and how can it hamper that? The eye and the ear, we know the actual structure of the tooth and where all the nerves are there, so we know it doesn't dissect that part, so it won't influence their eyes, their ears. So this is a myth which actually they carry from the generation, because people believe what they want to believe and they hear what they want to hear. They should basically ask a dentist, the person who has the knowledge, and then correct themselves. Then just stop believing such things which is curing, which is creating a problem from them.
Mhm.
And there are many other things I think which is going on, and I think that is why I've come up to this program so that I can speak about it.
Right, right, Dr. Sabha. We need people like you, advocates like you, who talk about such important issues which are neglected by the general society. I mean, people talk about everything but dental health, and that's what intrigued me initially. Also, while talking to you, I felt that you are out there with a purpose to bring that change in people where oral health is considered, and this is the best possible opportunity that you've given us also by being on this show. So thank you so much,
Thank
Dr.
you, Chris.
Sabha. Dr. Sabha, I would also want you to tell us more about what do you think is the impact of not following preventive dentistry.
Preventive dentistry, I think it has a huge impact. For example, let's start with the kids. Today's kids are having all kind of snacks because of the hard life of parents and the food industry which is growing. So basically, they are eating more of carbs and sugar. There's a lot of amount of sugar which is there. Even the thing which is not sweet, it will have good amount of sugar. Eventually, that is going to deteriorate their dental health. So it's something worries me now when I see the kids, is that every kids, mostly out of 5 kids, 3 kids will have good amount of dental caries, and they are coming for extraction. They are wearing crowns. The kids are wearing crowns is something so much hard for me to understand, and that is why the understanding of tooth prevention is so important to the parents, so that they take care of their kids and they teach their kids all these things.
Right. Right. It is important for even parents to understand this whole issue and how it's going to hamper the health of the child. So, dental health is something that they really need to focus on and take care
And
of.
Dr. Reshma, and the prevention thing, one more thing is there, that people are just wanting to go for implants. I'm not saying it's bad, it's good. It's an option available when you do not have a teeth, when you have lack of teeth. Okay? It's a good thing. Implants are there, there's a denture that everything is good, but it doesn't mean that you want that only. You can just take care. And the prevention is an idea by which I means ki we just don't try to save the teeth, we also try that whatever the rest is there is safe. It doesn't need any more further dental treatment. It is in the best vital condition. It is having all the blood supply which it needs. So that is what I mean by prevention. That you prevent it from further disease. This is what I
Right.
mean. And this is
Right.
what
I
I want to.
agree. I agree. Yes, I agree completely, Dr. Sawa, because I think teeth are the part that we so much ignore that, I mean, I've seen people opening bottles with their teeth. They don't take care of it at all. They don't even bother to understand that, how they are actually hampering their teeth, and how it's going to affect at a major run, how it's going to affect in the longer run. So I think that is something very important. And I think awareness, Dr. Sabha, is something that is lacking because we talk about awareness in different diseases. We talk about nowadays lifestyle diseases. There's a lot of programs that are going on, awareness for that. But where dental hygiene, dental health is considered, I don't see much happening, right? I don't know whether you agree with it or no, but that's what I feel. And I feel that we really need to now get into the awareness part of it, and there should be programs that cater to dental health too. What do you think, Dr. Sabha?
There should be even the help from the government. This is what also I think, and I think government plays a huge role if they just put in attention to the people. This is important. Something should be kept mandatory, like in US they have the rule of brushing, they have the rule of flossing, cleaning the tongue and using a mouthwash. This is certain rules they follow, and this rules doesn't cause a problem, they eventually help a person.
Mhm.
So I think certain rules should be followed. The government should the people who are not able to have the money to get the treatment done, the government should help them with certain programs, certain ideas, so that they can come and get the treatment done. Eventually, such poor patient comes and they ask for extraction. So I feel very bad. So there is a lot of help which we can get even among the dentists, if we all create a group and try that. Let's this amount of implants in the RCD cases are there. Let us all together target that the cases are reduced by next year. you know this is how everyone can target, and this is how even patient can get motivated. So I think this should be certain clicking thing which should happen in every person, and then it will definitely happen down the line. After 10 years, I'm sure everybody will be like, awareness will be spread, because it was so much of cavity and so much of surgery will be done that they will realize no, now it's a must. But I'm like, why to wait for that? Let's start today.
I agree. I agree completely that why to wait for that time to come that situation is already out of hand. It's better to take preventive measures and start working towards that. So, Dr. Sabha, you see a lot of patients every day, and you've been treating them. What are the most common dental problems that you think are neglected totally by people?
The most common is a cavity into different layers. Okay, and patient generally comes with pain is something which I always keep telling my patient, don't come with pain, don't
Mhm.
come with me. The idea behind is that the tooth has many layers. It has all three layers, and in between the layer, the main the core of the tooth is actually a pulp. The pulp means it has all the nerve supply, all the blood supply, from which, for example, Dr. Reshma, if you chew something and something like stony comes in your mouth, Turant you will realize, no, there is something stone which have come. That is because of the sensation in the mouth, right? When the patient comes, they eventually come and there is a lot of pain means the part which is core is actually having the cavity there. So whenever the patient comes with the pain, it clearly means the end stage dental treatment. It is an end stage dental treatment where we are actually trying to save the tooth down the line for 10 years, 12 years, or 15 years. Okay, it has lost all its vitality, or if a little bit of vitality is left, I mean the pulp is left, we will have to clean it up so that you are able to have the tooth. So I think a lot of patient comes to me with pain, and I keep telling my patient, don't come with me, come with pain. I'll try to solve your case with minimum cavity. And other than that, the patient also come with lot of pyria. The general term people use is
Mhm.
pyria.
Right.
We say
Yeah.
periodontitis, gingival recession, where the tooth size is increased and there is a good amount of bone loss. That is because of lack of cleaning. And the people don't get clean done because there is an idea behind, there is a myth, and the myth is that if you get your teeth clean, you are eventually going to get a bigger loss, because you will get a teeth gap, the teeth will start, there will be mobility in the teeth and all those things, sensitivity in the teeth. But that is all not true.
Mhm.
Definitely, there is a temporary sensitivity, but it's a temporary sensitivity because you're cleaning the tooth structure, and that is fine. But there is nothing hampering which we do. Anything which we clean, there is a lot of gap, when we clean, and the gap is there because they have so much amount of the calculus and tartar which we see. The gandagi is so much in between the two, that when, and that too is in white color, so they will have think that this is a tooth, that is a part of the tooth. Okay, so they
Right.
won't come to know that this is a infection, this is all gandagi. They won't think it like that. So
Right.
eventually, when you remove, there will be a space. Obviously, there will be a space. You made a space for all those kachra, and then definitely when you will clean it, it will be a space. But we didn't create it any space. We are not
Right.
creating any kind of space, so that's the
Right.
thing.
Yeah. Yeah. So, like you're saying that most of them come with pain, and like we've all heard that the dental pain is the worst. The kind of pain, I mean, it's unbearable. And I think at some point or the other, each one of us have gone through that kind of pain, that we've felt really. So in these situations, mostly doctors, dentists usually just give us painkillers and that's it. Is that the only solution, or there is anything else, Dr. Sabha, that can be done?
uh, Pain, solution like what, Dr. Reshma?
So, like solutions, like to deal with the pain, like why do you think that, like swelling of gums or the toothache, why do you think, what can be done to prevent it initially only?
Initially, one should take care. That is the starting, and one should start by getting a 6 month routine checkup done. You know,
Okay, yeah.
any dentist nearby, a 6 month
Mhm.
routine checkup should be there. No one should wait for pain, and no one should talk about asking their near one, dear ones, because they will give you some reply and they will become the dentist on their own, and they will make it bizarre for them. So I think one should go to the nearest dentist available and ask for their opinion. Never go with pain, which I said before. Pain is the worst condition, is an end stage treatment. And that is why I've come here to this platform to talk about not to come to the clinic, to any dental clinic with end stage treatment. So this is how one can, help themselves.
Right, right. So, Dr. Sabha, nowadays, like we're all talking about good, beautiful smiles, lovely teeth, and people are going overboard, doing things. What do you think about it?
These are veneers and laminates, which we say. There are even crowns, which we say. But there is two types. Veneerings are also good. Crowns are also good, but if and where required, and that a dentist decide. That is not you who decide. You, whenever you feel like you want to look better, whenever you feel like you want to look better, you have to go to the dentist and ask them that can this treatment happen. They will guide you what is good for you, what is best for you. So that is why I think all this treatment are good. Nothing is bad in any of those treatment until you are crossing the line of doing overdoing the treatment. People are getting themselves done a crown, because that's just in that's viral. So they just go and get
Yeah.
it done. That's madness. That's madness. Total madness. So I totally believe that one should get it done, and if they need it, they should ask the nearest dentist. And veneers and crowns are good. Veneers are something which requires minimum cutting. Okay,
Hmm.
minimum. Okay, but it requires a good expertise hand. A one who is really good at it. One should always approach a good dentist who is good in veneers, and then they should go not to anyone just like that, and then eventually lose the veneer, then again going for crown, then eventually a bigger tooth loss. So everything is a cascade of thing which happens after you're doing something wrong. So one should always take care of getting a right opinion from the right person, a right dentist, so that they don't fall into that pit. Everything is good. It's not bad.
Okay. Okay. So it's just about not overdoing anything and just going as per what the dentist, the need is, just not overdoing and taking the consultation from the dentist around so that whatever you are doing is not impacting in a negative way, right, Dr. Sabha?
Yeah.
Yeah. Okay, great. So, Dr. Sabha, like you speak about conservative dentistry, right?
Yeah.
So, in that, what are you already doing with regards to creating that awareness in that? Tell us
uh,
little about that.
just a minute, I'm fixing the earphone.
Yeah.
Yeah. For the conservative dentistry, can you hear me?
Yes.
Yeah, for the conservative dentistry, what I'm doing is that I try that, there is a pulpectomy procedure, RCT, which we say in the normal layman word, we say RCT is a root canal treatment. In root canal treatment, what is it? We remove all the pulp which is there, which is infected. So we have to remove it and fill it with a material we call that gutta percha. So we do that treatment when a patient actually comes with pain. Okay, this is the end stage treatment, one of the end stage treatment, and one should avoid getting RCT done by taking care of a good teeth. Okay, so you asked me about what you asked me.
what are you doing in terms
Yeah.
of creating awareness? Like you were
Yeah,
already
so what
also
I,
talking about.
whenever I face a case of RCT or a pain, I first of all try to conserve the pulp. That is my attempt, because if I conserve the pulp, I am able to keep the vitality of the teeth. And what I mean by vitality, that you have all the blood supply and all those things. Minimal amount of removal is there, so that we can have those kind of sensations which we need while chewing the food. It won't be a stony kind of feeling. So that is what I do. And other than that, for me, the conservative also means that, when I try to do the filling, I other than doing the filling for which the patient has comfort, and also do the filling for which the patient is not saying anything.
Right.
I do this complimentary, because it's my idea that I want to save the teeth, and it's my idea and I want it. So this is how I do the conservative treatment. Initially, I know that there is a problem, and I before patient complaining about it, I do the treatment on my own, so that the patient doesn't have the treatment. Then I guide the patient that I have done this and that. Now you have to take care, and this is the kind of brushing that I want you to have. I tell them about the flossing method, so that whatever comes in between the areas which you cannot clean with the brush is removed. Plus, one should always clean their tongue as well. All these things I keep telling me, and this becomes a conservative approach. Why this is a conservative approach? Because I'm avoiding the dental diseases which can happen in the future. So
Right.
initial treatment is a conservative approach, and the more it passes on in later stage, it becomes a more of a end stage kind of treatment, a difficult stage treatment where the patient will have pain. And you know what? The best part of the conservative dentistry is that there will be minimal pain, minimal injection, and less amount of time to the dental clinic. So conservative treatment is going to even affect, it's gonna be beneficial for a patient in many ways. Less dental treatment, less stony filling, less crown. So it's a very good thing, and this can be started. Conservative treatment is my word, but one can start taking of their teeth from their house, by maintaining the oral hygiene, and that is also a conservative treatment, which
Right.
one everyone can do at their home.
Right, right. Maintaining oral hygiene is very important, and when we are talking about this, I think in rural areas also, like not only in rural areas, even in urban areas, chewing tobacco is very common in India. Like, and there are so many problems people are facing because of that, oral cancers and those kind of things. So in that, how can hygiene play a major role, Dr. Sabha?
First of all, having those tobaccos and all is something which I never understand. Why a person have such kind of habit which only has an ill effect. Uh, I think a person who has a tobacco, who eats tobacco and all those things. First of all, somehow it is very difficult to convince that patient to leave that habit,
Right.
because no matter how much the people around their family will say to leave the habit, even they will somehow go to the dentist कि नहीं इतना pressure है जाके दिखाई देता हूँ, and then they'll come to us and they'll say do this and that, and they won't do that. Okay, they won't do that, they won't follow, because any person who has any kind of bad habit like tobacco, ये supari, areca nut, okay, ये betel quid, what we say is pan, all these things are also a bad habit. पान खाना, सुपारी खाना, तंबाकू खाना, वो चूना जो पान में होता है, it's very cancerous. Okay, one should all stop this. But no one can stop it. It is they need some help. They need someone to motivate them. To so when a patient comes to me, I always tell to the patient कि never leave your habit suddenly. Okay, live it step by step. Like if you're having a 5 packets of tobacco or even a betel quid, a pan, so just lower down every 1 week, every the next week, coming week, it should be lowered by one dose. That's my target, so that leaving of any such habit, they have a kind of effect in your mind. You can't suddenly leave it, and if you leave, even if you want to, even after getting so much of motivational done by your family and by a dentist or any good doctor, they will still have it because there is a kick effect, and that kick effect is very difficult to come out. It's a big addiction, which even if they want sometimes and they think they will be able to leave, they can't. So they should always leave one dose 1 week, every week, not a day wise. I'll say week wise. It should be a slow process of 2 to 3 months, depending upon how much package or how much they consume, and they should live out, because eventually the moment they will stop all this habit, then only they can have a clean mouth, and then the prevention treatment can start. Because tobaccos and all those things causes so much of this gum problem and the teeth problem, that there is no oral hygiene in such patient. So basically they are no way around preventive dental care, but
Yeah.
they won't have any pain. Such patient do not have any pain, because what is the effect of this thing is that they जो नसें होती है ना उसको पतली कर देते हैं. The myelination is there, it thickens, the layer
Right.
thickens, there's a lot of vibration around the nerves and all those things happen, and so they won't have the pain.
Right.
So that is not a good thing that you lose the pain is a good thing, it's not a bad thing. Your body is telling you of certain thing which is going wrong in your body, and if you are not having that thing, it means the things which has to go wrong will keep going wrong until it is into a very bizarre stage and end stage of treatment, and then you come and you get the last help which we can give you. Might
Mm.
be a cancer or might be something more bizarre. So I always say to the patient, leave your tobacco habit little by little, don't leave it of a sudden, because it's a kick. Even you think, most of the patient will say I can leave it, it's just like this, it's just like that, but it is very difficult, and one can do it. They just need a good person to motivate them, and we can motivate once. They need someone in the family who can motivate them. Like for example, I shared with you something which happened in my clinic, is that one patient who was having at least, I think, one finger mouth opening,
Mm.
very bad.
Yeah.
One finger mouth opening is there, and the patient I motivated. It's not like that I didn't motivated him only, I motivated many other. He was just one of the case, but that case successfully resolved, and that is just not because of me. It's because of him. It's all because of him. We can just help you, but it's only one own person can help themselves. So he actually helped himself. He had a daughter, and for him it was very difficult to be like this in front of his daughter. So that motivated him, and within 3 to 4 months he actually did the exercises which I did every day, daily, meticulously, without leaving a single day. And he's been able to open his mouth. And that
Wow.
kind of disease needs surgery, let me tell you,
Surgery.
needs
That's what all I
surgery.
was going to say. It needs surgery then.
Need surgery to cut the fibrous band. There is a lot
Yeah.
of fibrous band. We need to cut the fibrous band. And even after cutting the fibrous band, if the patient is not able to exercise, the fibrous band will regrow.
Right.
The surgery will fail. So nothing can help a person. It's their own self. So even if
Lovely.
we can motivate once, but they need to get themselves keep motivated every day. Every day should be a motivation. Only then one can achieve.
Lovely, lovely, Dr. Sabha. This was such a milestone example that you've told, and because many people, because due to chewing tobacco or cigarette smoking, have this issue, and the end thing is that the dentists tell them is resort to surgery, and which is again, like you said, not the answer. So it is within that they find that motivation to leave that habit that they are getting affected with, and are able to exercise. That's what you've said is very nice, and I think
And
that's
one more thing I want to add, because we are talking about cancer and pre-cancerous condition. Both are a type of cancer only. But I want to add something big thing. It's not that only tobacco, the supari, the bitter quid, and all these conditions causes cancer. A lot goes to the way we live our lifestyle. You our lifestyle plays a very important role. People say I do not have tobacco, but still many of the patient has cancer and have nothing like that.
yeah,
Why? Because it's all because of our lifestyle causing a lot of stress. We are not giving time to our own self. We are living a very stressful life. Always trying to achieve something and failing. I think this is a kind of a pressure which we have in today's society, and that pressure is leading into a cancerous condition, not just in mouth, in the whole body. And
right,
stress is one of the etiology, I mean one of the causes which it has impact all over the body. unknown diseases can come in your body just because of the stress. So I think everyone should, live a life allowing themselves to give time to their own self so that they reduce the stress. If they reduce the stress, they will even reduce any kind of diseases, even the cancer. The chances of it will really reduce. So
Agree.
I think one should eliminate stress also, and I think tobacco is second for me. Stress is the bigger one. The number one factor is the stress. So I think one should never, put so much of pressure into their own self, that I can do, and later their body is in so much of pressure. The body will still keep listening to you and keep doing it. But one has to listen to their body. It is our own job to take care of our body. No one else will come and take care of our body. So we need to
Very
take care
true.
of our body, our own system. And if we take care of our own system, we will have a very healthy lifestyle, free of any diseases in the whole body, not just in dental. So I
Right.
think one should work on reducing stress. The cancer will not be there for sure.
Okay. Thank you. Thank you so much for those pearls of wisdom that you've shared with us, Dr. Sabha. There are certain questions here which we can, if you can see, somebody has asked family vlogs, my teeth have white color lining. What should I do? It's in the
White
comments.
color comment
Yeah.
section, actually I cannot see. My section it's
Just
so I.
next to the private chat. Yeah. Yeah.
See
So,
the conditions like white stripe, it's something I exactly cannot answer, because many factors are there. So just by listening to the complaint, I can't answer because I
right.
might be guiding a person wrong, which I don't want to do definitely. So
Right.
white stripe can be something which can be from birth. So basically, he had white stripe from white what age? It's something which matters to me. From when he had that stripe, what kind of stripe is there, that I have to see, and then I can answer it more accurately. Because normally the white stripe here, it's because of condition like fluorosis, hypoplasia from the birth basically. So it's basically more from the birth, and they can't do anything. Only they can do is that either they can live with that white stripe or get a veneers done. No, veneer, which you said, it's zero
Right.
point 0.5 millimeter of the cutting is there, and there is the place of veneer. And then it's not a very invasive treatment, but definitely it's a very costly treatment, and one should get it done by an expert hand on.
Okay. Okay. Yeah. Jhalak Gaur says, kudos, Dr. Sabha, for taking care of your patients. That's really sweet. And there's Archana Gupta saying that, how do you create awareness among younger people who are addicted to tobacco, the younger generation? Do you conduct seminars or webinars for them?
I do a campaigning, and other than that, a free dental checkup session, which we also have in our clinic. Other than we go to and visit places, and then we do a campaign. This is how we uh, tell people that dental awareness factors. We guide them, we help them, we try to motivate them. We just say, I say they try to, because rest is in their own hand, and I hope they
That's
understand that. So that
that's
is
true.
why, that is how I try to motivate. And I think the best way I can motivate is that one is my patient, and I keep pushing. That patient might be like, why this doctor is keep saying me take care of that side, take care of that side, because the patient don't know what will happen in that side, in that part
True.
of the tooth later on. And I know it before. If that person goes careless, they will then that site might be more infectious, which is not right now. So I keep telling my patient the areas, and I guide them, take care of this area, take care, and how to do it, so that they can avoid the disease condition later on.
Hmm. Right. Thank you so much, Dr. Sabha, for really helping us understand the importance of dental health and preventive measures that are needed to be taken to protect the smile, the beautiful smile that we all have. And let's all not ignore our oral health. There are people like Dr. Sabha really working hard to create awareness and be there to say that preventive measures are better than curative measures. So please prevent uh, those kind of oral problems that you can face in future by taking real good care of your teeth and of your mouth. So keep your beautiful smiles intact with this information and keep practicing what Dr. Sabha has already told, which
Yeah,
is
and one more thing, Dr.
yeah,
Reshma, I want to add one
yeah,
thing
sure,
which is I think is very
sure.
important.
Yeah.
One is that one thing which I really want to add is that brushing to the kids. You know, nowadays there is a lot of sugar, as I said initially, in the food. So every parent should at least once a day should brush the kids' teeth. You know,
Mhm.
and once the kid will do. There is a two-time brushing habit. The once the
Right.
parent will do and the once the kid will do. That is how you can prevent the cavity,
Mhm.
caries in the kids, and that is very important for every parent to start doing it. Brushing their kids' teeth. The parent should do it once, and once the kid should do, so that they inculcate this habit. Okay, and cleaning the tongue from the beginning to the kids, so that you can avoid the future problem. So I wanted to add. It's why I interrupted you because I do
No,
not want to
that's
do this.
all good. You are the expert. So, as Dr. Sabha has said, please take care of your oral health and your child's oral health. And thank you so much for watching, for commenting, and I hope you all liked this show. Thank you, Dr. Sabha, once again for honoring us with your presence. It means a lot to us. So, thank you so much. And over to you if you would like to say something. Yeah.
I would like to say to everyone, if they really want a good information, going into their minds, and please subscribe to this channel and get all those important information which you need in your life so that you can improve your life. So please subscribe right now.
Thank you, Dr. Sabha. Yes, please listen to Dr. Sabha. Subscribe right now, like and share with others so that this information can benefit many more. Thank you so much. Like always, we'll meet you next week, same day, same time. Promise to keep it real always. Thank you so much.